Hello, everybody. Thank you so much for joining us. We're so happy to be here at the Applied Self-Direction Conference. I'm excited to be here today with my co-presenter, Rosie Bartel. Hi, Rosie.
Hi, Dan.
And we're excited today because we're excited to be here to share Rosie's journey and how self-direction and self-advocacy have helped her live a meaningful life and live a self-directed full life in her community. Rosie, would you like to introduce yourself?
Sure. I'm a widow, a mother, a grandmother, and an educator. My background is education. And so basically when 13 years ago, when I started this journey, I immediately started saying, how can I use my story to help others and make sure that others can find a way to make sure that their story is heard and told, and that they have a way of advocating for themselves. So I've used my story, and I call it storytelling with a purpose. And so that's part of why self-direction and self-advocacy is so important to me, and self-determination, because I don't want to be in a nursing home. I don't want to be in assisted living. I want to be in the community doing the kind of things that I do every day. Back to you, Dan.
Thank you, Rosie. And my name is Dan Crone, and I work for a Wisconsin-based organization called TMG, and I work as the manager of the community partnership team. I'll share a bit about TMG in a moment, and if you want to go to the next slide, I did want to mention that Rosie is also an author, and she's written a book called Rosie's Story, which will be exciting for her to share more about that in a moment as well. So today we're hoping that hearing Rosie share her journey, advice, and her guidance, it'll reinforce the importance of self-determination and how self-advocacy can not only improve the quality of your own life, but others as well. And we're hoping that you will learn how you too can apply the principles of self-determination and self-direction in your own life. So a little bit more about the organization I work for. You can go to the next slide. Thank you. TMG is an organization in Wisconsin. We're an IRIS consulting agency. IRIS is a Medicaid-funded long-term program offered by the Wisconsin Department of Health Services. The program was created by Wisconsin in 2008 as a home and community-based long-term care option for people 18 years and older. IRIS stands for Include, Respect, I Self-Direct. IRIS is considered Wisconsin's self-directed long-term care option, and it's available all across all 72 counties across Wisconsin. The main goal of the IRIS program is to provide you with the supports you might need to stay independent in your own home as you work towards achieving your life goals. The program is built upon the belief that people of all ages and abilities have the right to lead a meaningful life. I'll share more a bit about the IRIS program and how it works as I share just a little bit about how TMG partners with people to self-direct their lives. You can go to the next slide. So TMG is really, it really partners around people around these 6 main areas of their life: developing valued roles in their community, identifying their short and long-term goals, accessing local resources, creating individual support plans and service plans customized to the individual, supporting responsible use of their planned budgets, and supporting people finding meaningful days through employment and community engagement. Now, the TMG organization that I work for has been partnering with people since IRIS began. And the organization is really built on the foundation of relationships. We recognize that everybody has their own unique talents and skills and interests and ideas that make them feel accomplished and in control of their life. Through IRIS and with the expert guidance of TMG IRIS consultants and support of other partners across the state, we work with people to customize a plan that meets their care needs and essentially enhances those assets of their life. Iris can help people create the life they want with the supports that they choose and they need. So that's a little bit about the TMG organization and the Iris program. If we want to go to the next slide. At this point, I'd like to turn it over to Rosie to share a bit more about herself and her journey.
Well, my journey started on August 17th of 2009, and that journey started with a knee replacement. Now, this was my 5th joint replacement, and that joint, I had had 4 successful joint replacements, and I thought I knew everything about joint replacements. But from the beginning, this joint replacement wasn't quite the same as the other ones, and about 2 weeks into after the joint replacement happened, I started having oozing around the staples. And so when I went in to see the doctor to have the staples removed, I said, I've had a little oozing. And he said, oh, it's probably due to the staple irritation. Now, I always believed everything the doctor said and said, okay, that's probably true, and went on my merry way. And that night, the oozing started to get worse. The next day, I went to work. And by noon, I had changed my bandages like 5 or 6 times. And because it was a Friday and it was summer, I had summer hours. And usually I worked Friday afternoons catching up on paperwork, but I decided that I would go home because maybe I just needed to put up my leg for a few hours and the oozing would stop. Well, it didn't. By Saturday, I was wrapping my leg with a bath towel because bandages didn't even control anything anymore. And by Sunday, it was a beach towel. And yet I didn't call the doctor until Monday morning because I didn't want to bother him. And he kept telling me, he had told me it would probably go away. And I kept thinking, it'll stop anytime now. Monday morning, I called the doctor and he said, come on in at 1 o'clock. And I went in and he said, it looks like a hardware problem. And I think we need to change out the hardware, that some kind of dirt or something, some speck of dust or something got on the hardware and you have developed an infection. But I'm sure if I change out the hardware, everything will be fine. And so he changed out the hardware the next morning at 7 o'clock in the morning. I remember having to be at the hospital at 5, and they were doing surgery at 7. And when I don't remember anything of that day. Now, that wasn't normal for me. Usually I was wide awake in the recovery room. And by the time I got to my own room again, I was acted like I didn't have surgery. So I don't remember anything of that day of surgery. And the next morning, I had a new doctor standing at my bedside. And I remember he introduced himself and then he said, lady, you're very ill. You have a MRSA, healthcare acquired infection, and I give you about a 30% chance of surviving. Now, he may have said a whole lot more, but that is all I heard. And I kept thinking, do you understand? I survived cancer 3 times in my life. I'm a survivor. Don't tell me I have a 30% chance of surviving. I will survive this, and this is just a bump in the road. Well, this bump in the road turned out to be 58 surgeries, over 200 hospitalizations, over 100 blood transfusions. I have dealt with septic shock at least 14 times, if not more. And I had been to the hospital, rushed to the hospital numerous times, and was flighted one time to the hospital because they didn't think I would survive an ambulance ride to the hospital. So, basically my I can survive I almost didn't survive. But all along the way from the first day that this started, and as I got to know this infectious disease doctor, I kept saying to him, I don't know why this happened to me, but I sure want to make sure this doesn't happen to somebody else. And so very soon he realized that I wasn't the normal patient who got a healthcare acquired infection. I wasn't angry. I wasn't upset. I wasn't blaming anybody. I just wanted to protect others. And so I wanted to know how I could protect my family and how I could protect others. And so he said to me one day, he said, we're doing a study to evaluate why we are having so many um, MRSA infections, especially with joint replacements. And we've never invited a patient to the table, but I think we should invite you to the table because I think you have insights that we don't have. And I think you can help us figure out a way to better and improve our healthcare and patient outcomes. And so he invited me to the table, and I literally went to that hospital every day for a week and spent the day with, doctors and nurses and anesthesiologists. And I was the only patient in the room. I learned a lot about surgeries, things I didn't have a clue about. I always thought the minute those operating room doors opened, you were in a sterile field. Now I know that there's only a sterile field around the operating table. The rest of the room might have a lot of things in it that could cause you to get an infection. Also, the fact that I always thought once those doors were closed and people were prepared to do your surgery, nobody would come through those doors until the surgery was done. Not true. Lots of people come in and out of that surgery. Lots of people who might be salespersons or people wanting to sell a product to the doctor and wants to demonstrate it during your surgery. Not everybody that's touching you are people that you might even know. So I learned a lot during those 4 days. And on Friday, they were going to present to leadership what they discovered during their time together. And on Thursday night, the doctor said to me, Rosie, I think that if you told your story, we'd have a better chance of implementing all the things we decided to do this week, like making sure people don't open the doors and don't come in during joint replacement surgery, or making sure people didn't wear fleece during surgery because fleece rubs skin particles off your body and it can be picked up into been blown over the surgical field. So, and he said, but the leadership doesn't know your story. They don't know what a healthcare acquired infection might look like in the long run. So this was even before I had my first amputation. And I've had a total of 3 amputations, which I didn't tell you in my list of things. I've had a total of 3 amputations. I'm amputated all the way to my waist, and I just have a little bit of pelvic bone left on my right side due to the fact that if I lose that piece of pelvic bone, I would have to have reconstructive surgery. So I've opted, even though it's infected with MRSA, to keep the pelvic bone and had all the tissue around it pretty well removed so that it's less likely to get an infection, or when I get an infection, it may not be as severe as when I had tissue there. Anyway, very early on, I realized that I tried to continue doing my job. I continued working at my job, which was a very full-time job. I was very used to working 12 to 14-hour days and loved every minute of it. It was my dream job. I was, as an educator, when you can be educating other educators, that is the point of being a dream job. And that's what I was doing. I was educating teachers how to teach religion to to children. And so I felt like I was touching people in a way that lots of people couldn't. So I continued working, and even then, I at one point they fused my leg, and so I couldn't drive at that point. So then my husband stopped working his job so he could take me to work and to pick me up from work and spend the day trying to do other things. And so very early on in my journey, he realized that working was very important to me. So he stopped working, and I continued to work. But I also started doing some patient advocacy work. I started telling my story more places than just at this hospital, and I started being asked nationally and internationally to tell my story. When David quit his job, that meant we lost part of our income, and so we were struggling. We were struggling financially. First of all, we were struggling because healthcare bills mount very quickly, and especially when you're getting IV antibiotics that cost $3,000 and $4,000 a dose, and your health insurance covers parts of it, and you have very high deductibles, and you're going in and out of the donut hole, and all the things that can happen to you with health insurance. Um, my doctor bill basically, we had to give up our home, and I had to use my 401k, and we had to use up our savings. And very soon we were struggling financially. And someone then said to us, I think Wisconsin has a program where your husband might be able to collect and be paid for some of the time that he takes care of you. And so I started looking into it and found out about the IRIS program. And the IRIS program for me and my husband and was a lifesaver. First of all, it not only gave him an income, but it also gave him respite, which up until that point, we couldn't afford to hire or to ask one of our children to take off a day of work so that he might be able to do something outside of um, taking care of me. He was my full-time caregiver. He did it with a smile on his face. He never complained. Um, I did lose him during COVID, not to COVID. Um, when COVID began, he's the man behind me in the first picture. When COVID began, he had a backache, and he went to the doctor, and the doctor kind of blew him off and said, well, you and Rosie aren't traveling around the country, and you're not pushing your wheelchair everywhere so that she can tell her story, and I think you're just not getting enough exercise. And so that was March of 2020, and his backache kept getting worse and worse. We tried a chiropractor. Chiropractor, after about 4 weeks, said, you're not getting any better, and I think you need an MRI. So between David and the chiropractor, they convinced the family doctor that maybe he needed an MRI. And so on June 26th of 2020, he had an MRI at 7 o'clock in the morning. At noon, he got a call saying, could you come in this afternoon at 1 o'clock to go over the results of your MRI? Now, remember, it's COVID, so I couldn't go with him, and he went alone to his appointment. At about an hour and a half after he left our house, he texted me and said, Rosie, it's cancer. And that was the text I got. Now, what he did was he got in the car and he said, Siri, tell Rosie it's cancer. And then he began the drive home, which is a 45-minute drive. And so I'm texting him saying, what kind of cancer? What do you mean? And well, how are we going to treat it? And I'm asking a million questions and not getting any answers. Well, when he got home, he said he had two kinds of bone cancer. It was secondary to something else. And basically, they were going to wait till after the 4th of July to do more testing, and then they would figure out what kind of cancer was primary, and then they would consider a treatment plan. And I said, well, wait a minute. I have an oncologist, hematologist, oncologist. We're going to go see him. And so I called our family doctor and said, send a referral to this doctor. I will get an appointment with him next week. And so I called on Monday, and they had an opening on Tuesday. On Tuesday afternoon, we went in to see the doctor. Before we left at 5 o'clock, we knew he had pancreatic, liver, upper GI, stomach, and gallbladder cancer. We never did figure out which was the primary. They ran some more tests. Very soon he was told that he had less than 6 months to live, and it was probably on the short end of 6 months. And they could offer him either hospice or what they called comfort chemo, which might help with the pain. He had one dose of comfort chemo middle 15th or 16th of July, and that comfort chemo could either help or make it worse. In his case, it made it worse, and he lived 8 days. On July 28th, we lost him to the cancer. Now, here I was, my major caregiver was now gone, and I had to figure out how to now live alone but still have some help. And so my children now stepped up to the plate. They all, I have a son and a daughter and their families live in the same community I do. So they are my caregivers. They come and go and in and out of my house all day. They don't have the same address as I do, but they probably should, somebody, because they do come and go and make sure that I live a safe life in my apartment. And I can do the things I was doing. I do self-advocacy, and I do advocacy for patients. I do presentations for healthcare providers across the country. And during COVID, not because of Zoom and the world being locked up, we learned that we can do presentations across the world. And so during COVID, I have done presentations on 6 of the 7 continents. For 2 years, I didn't do any in-person presentations. I only did all of my work virtually. But last year, I did 5 presentations in person. And now I've started up doing in-person presentations at conferences and have started going back to hospitals and doing presentations. And so it's because of Iris and the ability of me being able to say to one of my family members, could you spend the day with me and go with me, because I want to make sure that, I can spend the day and safely doing these things. Or could you travel with me? Could you fly with me to Florida or Texas or DC, Washington, DC, or I will be probably going in May to Copenhagen, Denmark, to do an international conference person. But it's because of Iris and the fact that they can do those things and are able to, they have to use their vacation because the amount of hours I have with Iris doesn't cover nearly the amount of hours that they spend with me. But it does give them a little bit of income so that they can help me and help me with being able to live alone. And it's very, very important to me to be able to live alone and to share my story, and to share my story of how I use my story and help others use their stories to change healthcare and to change how things happen in the world. And it was probably about 4 years ago, maybe 4 or 5 years ago, that Iris and TMG in particular came to me and said, would you share your story with us? Would you tell your story, and could we use it in our newsletter? And would you consider being on a board on the TMG Patient Advisory Board? And I said yes. And, I used to say, go to TMG meetings in person. And I would say when I left that meeting, I am very, very lucky. I am an amputee who started using a wheelchair at the age of 62. Yet, I meet people every day at these meetings who have been wheelchair bound their whole life, who have dealt with disabilities their whole life. I'm in awe. I'm so glad that Dan used the picture of my good friend Stacy. And she was the picture in the slide just before this one. Stacy lives alone. She has a rare form of cerebral palsy, and she lives alone. I have to tell you that this summer, one of my granddaughters became her caregiver, one of her caregivers. And I encouraged her because Stacy, as we all are right now, struggling to find caregivers. I'm very lucky because I have family members who are willing to step up to the plate and be my caregivers. But Stacy struggles to find caregivers, and she has ads all over the place and on Facebook and everywhere that she can think of. And many times people make appointments to come and for an interview and then don't show up. And so I encouraged my granddaughter, who helps me on many occasions, to maybe go and work for Stacy this summer. And at first she was a little leery about it, but then she said, "Yeah, I'm going to go do that. I'm going to go work for Stacy." And so my granddaughter went to work for Stacy, and just before she left for college, she said to me, "Grandma, I'm so glad you pushed me to work for Stacy, because it's not just about the money. It's about the fact that I gained a ton of confidence working with Stacy, and I developed a friendship I would have never had, and an understanding of what it's like to live with a disability that I knew what life was like for you, but I didn't know what life was like for somebody like Stacy, who uses her computer or her phone to talk, and who many times has developed a communication format with her workers that is completely different than what you and I might be communicating or how we might communicate. I remember watching her and Stacy at a self-determination um, workshop or conference here in Wisconsin a couple months ago, and I spent watching them from a distance, and both their arms were flaring and they were communicating. And Stacy never touched her phone, but they knew, and she knew exactly what Stacy needed, and what they were talking about, and what she was trying to communicate with her. So I think that the whole workers and the self-determination and the self-direction is not only important for the person who needs that care, but it's also important for the workers to learn what it's like to live with a disability. I don't believe people often know what it's like. For me, I hadn't driven in 10 years. And then through the IRIS program, through lots of hoop jumping, I have to tell you that many times I say, if we treated our people with two legs or without disabilities the way we treat people with disabilities, we'd have an uprising, because I did eventually get a modification to a vehicle so that I can drive from my wheelchair. And so I have a power chair now. I don't have a manual chair, but I have a power chair that I worked through Medicare and Medicaid to get. And now I have a van that was modified through the IRIS program. And so I'm able to drive with my left leg. And I'm able to now at least get to doctor appointments and things. And I don't have to always be asking my family to um, take off of work to get me to a doctor appointment. But it still is one of those things that happens. It's sometimes I'm not strong enough to drive to the appointment, and I still need them to drive me. But at least I can now go with my power chair, and I have a van where I can either lock in to drive, or they can lock me in and they can drive it. So the IRIS program has been a godsend, and I would probably be in either assisted living or a nursing home if it weren't for IRIS and TMG. Um, and I'm not sure I would be alive, because the work I do every day, the advocacy work I do in helping healthcare providers and um, patients understand and communicate better with each other is probably the most important work I've ever done in my life. I'm I want to pass this back to Dan, and I want to see if he has any questions or thoughts at this time that maybe there's something he'd like me to cover that I
Sure.
haven't covered.
Well,
Dan,
thank you,
back.
Rose. Thank you, Rosie. Yeah, thank you for sharing your journey. You have an amazing journey, and you continue to amaze me with the work you've done. You've certainly had your share of challenges and obstacles, but you've overcome them, and you're continuing to not only self-direct your own life, self-advocate for yourself, but you're improving the lives of others as well. So thank you for sharing that. I did want to ask you, would there be, is there one piece of advice that you would give to someone that's maybe new to that's advocating for their own needs, self-advocating or self-direction that you would want to give to somebody?
My part of my advice is that always look at your safety and making sure you're safe, but then don't limit yourself. Do as much as you can, it, but make sure you keep yourself safe. So make sure you have the help you need to do as much as you can and want. You know, I believe that my mind. I always say if we ever have mind transplants, I want to transplant my mind in a young and beautiful body because that has two legs. Because my mind is very strong, and I have a very active mind, and I can handle multitasking with my mind. And so I want to use that mind every day. And so find out what your talents are, find out what makes you happy, what makes you want to continue on this journey, whatever your journey is, and find a way of doing it in a safe way. And that's one of the things that Iris gave me, was the ability to have the help I needed to do it in a safe way. Also, make sure you check out what your state offers. Every state has some kind of program. I have to tell you that I'm very lucky that I live in the state of Wisconsin, because I'm very aware that many states don't have what Wisconsin has. But I have to tell you, it wasn't somebody in the state of Wisconsin that told me about Iris. It was somebody in the state of Michigan who said, I was really struggling, and we were struggling financially because I had this disability. But then Michigan has this program, and my husband, gets paid a small amount, gets paid for some hours that he takes care of me, and that's helped us tremendously. We're not struggling as much. She said, I think Wisconsin has that same kind of program. And so then I proceeded to start checking into it through the Department of Health, and found out, yes, we did have a program. And that's how I got involved with Iris. But it's interesting because sometimes those secrets about programs that
Right.
we have through the Department of Health or other places are kept very secret, and we don't always know about them. And the people that need it the most don't know about it. So that's the other advice I give.
Mhm.
Check out what your state offers. Make sure you're getting everything you could possibly enroll in, so that you are aware of everything that's available to you.
That's great advice. Absolutely. So, Rosie, you've traveled the world and in your role as a healthcare patient advisor, and you've met with countries, as you mentioned, virtually and in person around the world. In your role as a healthcare advisor, meeting with hospitals and healthcare professionals, is there one accomplishment that you're most proud of through your advocacy?
I guess I'm most proud of the fact that I think I've made a difference. My goal was to make a difference in one person's life every time I did a presentation. That one person would at least say, I'm going to do something different. And last year in Dallas, I was in Dallas, and I had a room full of almost all providers, mainly doctors. And as I was leaving, as my daughter and I were pulling away in the van, he stopped us and said, I want to tell you that because of you, I'm going to do things completely different Monday morning. I'm not going to treat my patients in the same way. And I'm going to look at patients and how I treat them completely different. The other picture that's on this picture here, on these two pictures, is
I was going to ask you about that next. Yeah.
is a picture of myself receiving an award last year. It's probably the most prestigious award, at least in my book, that a patient could get. It's the Patient Family Innovation Award from the Barrel Institute. Now, the Barrel Institute is a patient experience organization. So, first of all, this is Jason Wolf. He's the founder and president of the Barrel Institute. He and I have been friends from about the time he started the organization. We've been friends for about 12 years, and that's how old his organization is. I remember him being at a conference and he and I saying, we need to do something together because we think alike. And his whole theory on patient involvement was very similar to mine. And so we always shared ideas, and eventually he invited me to be on their Global Patient Advisory Board. And then last year I won this award and the award is not for the work I do with providers as much as the work I do with facilities and environmental services and researchers and those kind of things. I don't just do presentations for doctors and nurses, but I do presentations for maintenance and security and environmental services. And I do a ton of work with research and researchers, not only um, in healthcare, hospital healthcare, and but also in long-term care. I believe that MRSA and all of the healthcare acquired infections, that they call it medical errors. I call it the day that something went wrong, that nobody knows why it went wrong. I mean, if you ask somebody what happened to me, they'll say it was a medical error. I say nobody got up that day to give me MRSA. So I don't consider it a medical error. I consider it the day something went wrong. And there's a multiple reasons why something went wrong that day. And trying to figure out what the reason was is a waste of time. Trying to figure out how we make sure it doesn't happen again is important work. And that's why I got this innovation award, not for the work I do with nurses and doctors, but for the work I do with all other departments in healthcare and also nursing homes and long-term assisted living and licensure licensure from the state of Wisconsin and other states will reach out to me to do hand hygiene presentations, because hand hygiene, I believe if we could solve the hand hygiene problem in healthcare, we probably could cut all infections by 90%. That we would probably have a very, very low infection rate if we could convince people that hand hygiene is probably the most important thing that happens in healthcare.
Well, thank you for your amazing work, Rosie. You've been an amazing advocate out there, continuing to strive and partner with healthcare providers around the country. How do people find out more about yourself and the work you're doing?
If you go to the next slide, first of all, that's my email address. I answer all emails. So if you want to know more about my information, my my information, or if you want to know more about my story, that is my book. You won't find it on Amazon. You won't find it on the internet because it came out in 2020, and I've either sold or given away more than 1,000 books, but every one of them was signed and personalized. And so I don't give it away. I make sure that it is a personal note to you, to the person that's getting it. Also, if you ever want me to present to your healthcare or to your organization or to your Department of Health, I'm very open to doing that. And just reach out to me, and I'm sure we could work something out. Thank you.
Great.
Thank you for letting me share my time with you today.
And thank you, Rosie, for being here with me today. I truly appreciate it. And thank you all for attending our session.